Prior to starting a knee procedure, we will measure the ASIS or the anterior superior iliac spine to tabletop. This measurement will indicate the angle of the central ray for both AP projections and AP oblique projections. To measure the thickness of the pelvis, a caliper should be used. I'll be using a measurement here. I'll be using a tape measure instead. When the ASIS to tabletop measurement is less than 18 cm, the central ray would be angled 3 to 5 degrees caudad for both AP projections and AP oblique projections. When the ASIS to tabletop measurement is between 19 to 24 cm, the central ray is perpendicular for AP and AP oblique projections. When the ASIS to tabletop measurement is greater than 24 cm, it requires 3 to 5 degrees cephalad angle for both AP and AP oblique projections. Our patient here measures 14 cm, so for our projections, we will use a caudad central ray. Properly shield your patient, and we will begin with AP projection of the knee. Position of patient. Place the patient in the supine position and adjust the body so that the pelvis is not rotated. Central ray directed to a point 1/2 inch inferior to the patellar apex. Variable depending on the measurement between the anterior superior iliac spine or ACES and the tabletop. Ask the patient to turn onto the affected side. Ensure that the pelvis is not rotated. For a standard lateral projection, have the patient bring the knee forward and extend the other limb behind it. The other limb may also be placed in front of the affected knee on a support block. This image is a improperly positioned lateral knee. Note condyles not superimposed and patella is close joint. This second picture is the same patient as the image earlier after correct positioning. Condyles are superimposed and the patellofemoral joint is open. Place the patient on the radiographic table in the supine position and support the ankles. Central ray directed to a point 1/2 inch inferior to the patellar apex. Variable depending on the measurement between the anterior superior iliac spine or ACES and the tabletop. Medial femoral and tibial condyles, tibial plateaus, open knee joint, fibula superimposed over the lateral half of the tibia, margin of the patella projected slightly beyond the edge of the lateral femoral condyle, soft tissue around the knee joint, bony detail on the distal femur and proximal tibia. Place the patient on the radiographic table in the supine position and support the ankles. The resulting image shows an AP oblique projection of the medially rotated femoral condyles, patella, tibia condyles, proximal tibiofibular joint, and the head of the fibula. Tibia and fibula separated at their proximal articulation, posterior tibia, lateral condyles of the femur and tibia, both tibial plateaus, open knee joint, margin of the patella projecting slightly beyond the medial side of the femoral condyle, soft tissue around the knee joint, Bony detail on the distal femur and proximal tibia.